in recent times, there have been growing concerns about whether the coronavirus vaccine had an impact on menstrual cycles. A new study published on Thursday has found that vaccines may temporarily change the menstrual cycle length, but that these changes are not clinically significant. This is the largest study to date that explores if and how COVID-19 vaccinations affect periods. To tell us more about this, we are joined by menstrual justice advocate and co-author of the book Flow, the book about menstruation, Pontsho Pilane. Pontsho, good morning to you, and thank you so much for joining us on Newzroom Afrika. Let's start off with, of course, your comment as to why this is possibly a win for women and really just for the public health sector in general.
Thank you so much, Teho, and good morning to all your viewers. I think it's a big win because, if you could remember very much last year, particularly as vaccination rollouts in different parts of the world and countries were coming in, like we're becoming kind of more regular, where more people were getting vaccinated. People who menstruate started taking to social media in their intimate circles, talking about how they feel that their period has changed since getting vaccinated. And this really prompted a lot of online chatter. The problem was that there was no evidence-based research to back this up. And so in September last year, an academic from the UK, Dr. Vicky Mail, she wrote a seminal editorial in the British Medical Journal around the fact that the need for more research to be done into the links between being vaccinated and what the implications or the effects on a menstrual cycle could be. And so we've seen a few small studies, like you just said. This is the study that was published in the Journal of Obstetrics and Gynecology just last week, is the largest of this kind of study, and it really gives us insights into why or what really happens and what could be affected when people who menstruate vaccinate. And this is important, particularly because anecdotal evidence that the public from across the world that they have been talking about finding or feeling changes in their menstrual cycle.
Now, Pontsho, we do know as women that just one day of change, whether it's an additional day or one day less, can be very uncomfortable. So, of course, this study, the importance of this study being conducted is something that we also need to speak around.
Definitely. The importance of the study, like I said, to see what exactly is happening. So what the researchers did is that they looked at data that was coming from an FDA-approved app. The study was done firstly in the US. And so they looked at data of 4,000 users of this app that tracks your period. And what they did is they got permission from the 4,000 participants to be able to look at their data before and after vaccination. And the 4,000 participants, it included people who were vaccinated and who were not vaccinated. This study was done in the US, so most people were getting the Pfizer BioNTech vaccine or the Moderna vaccine, which is not available in South Africa. And researchers looked at what was happening in between, before and after vaccination, and what really are the causes. And like the research paper says, there have been changes that have been noted. However, researchers and the lead investigator are saying that these changes are not a cause for concern, and that as far as data shows, there is no link or there has not been a link between vaccination and perhaps causes of infertility, which has been a leading misinformation tactic that has been used on social media, particularly in parenting forums on social media platforms such as Facebook groups. And so this is very important, particularly for people of reproductive age, to understand that their fertility is not affected by these minor changes, because the research that has been presented, not just only from the study that came out last week, but from the smaller studies that have been coming out over the past few months, particularly around menstrual cycles and vaccination, show that there is no link between these changes and fertility. And it's very important that we understand that the absence of evidence-based research does not mean that researchers, institutions, public health institutions are denying that certain phenomena, in this case, changes in the menstrual cycle, are happening. However, it is important that researchers do the research and try to find answers to these phenomena. And in this case, it's incredible that public, I don't want to call it outcry, but public concerns, people who menstruate advocating for themselves, talking about these changes online and putting themselves up for ridicule in most cases. As you know, sometimes it becomes incredibly volatile on social media to say, I've seen these changes, I'm for vaccination, but what do these side effects mean? Should I be worried? And we're seeing researchers taking a prompt from the public, from the community, to conduct research that offers important answers that could help us improve vaccine hesitancy and also could also help us understand the side effects of the vaccinations much better, so that we can that they can be explained to people before they even get vaccinated.
An important point that you make there, Pontsho, around the issue of fertility, and that this study that has been made, experts really saying that it is not clinically significant and that it shouldn't cause much worry. This, of course, falls back on what you've said around the importance of people actually getting vaccinated with the COVID-19 vaccine, that they need to remember that it does not stop their fertility.
Correct, Tiro. And on the note of fertility, it's not in the study, but there are multiple studies that were done on men and women, or on female or male fertility over the past year. And in December last year, a meta-analysis came out, a metadata analysis that looked at all the studies that had been done on fertility of both male and female after vaccination. And it categorically states that there is no impact. Vaccinations have no impact. In fact, there are some studies that have shown, particularly with male vaccinators, that contracting the COVID virus could have implications, or there is some correlation between that and infertility and impotency. But it's quite clear from the data, the evidence that has been collected through science, that there is no link between infertility, or that vaccination can cause infertility. However, the fact that this research has been done to understand better how COVID vaccinations impact our bodies, particularly the bodies of menstruating people across the world, is also important. And more researchers in this study that came out last week, Thursday, are encouraging that more researchers across the world need to do this. We need context in Africa and all the continents to understand exactly what is happening. As you know, we've seen how the information that we used on, let's say, the first 6 months of lockdown or of the pandemic is not necessarily the information that we're seeing here. We've seen the decreases even in quarantine and isolation time. The more researchers find out and do evidence-based research to understand the pandemic, to understand the implications and the science behind the pandemic, the virus, on our bodies in society, the better equipped governments and institutions such as the World Health Organization have to make decisions that are best suited for the public. But as the bottom line here is, there is a change. It's barely there. However, there is no cause for concern, and there is no big issue that the menstrual cycle length that is being changed in the study that is showing for the participants in the study.
Now, generally, Pontsho, do you think that there's enough research being done on side effects of new medicines or new drugs that actually come into the medicine world when it comes to menstrual health? Is there enough research being done there?
You know, Tiro, for me, as somebody who's been really working within menstrual justice, and if I reflect on that, I started doing this work when I started petitioning Parliament and members of Parliament in 2015 for learners in particularly poor schools to get free pads. And at the time, I had to put together a policy proposal to present in Parliament on why does this matter and why should this be an issue that is taken up by our members of Parliament and government. And I remember doing this research. I remember looking for the evidence and not finding a lot of it. And then we saw, this is about 2015, and we see that the interest in menstrual justice or menstrual health in terms of scientific research rising from around that time as well, across the continent, even across the world, in 2016 and 2017. And so I would say that we are seeing the more conscious researchers are becoming of this issue, and research is being conducted. And we've seen even fact-checking institutions such as Africa Check, who were the first to even look at the little data that was there to see. Particularly in South Africa, there was a statistic that said 7 million girls are not going to school because of their period. And even though that was a really good cause, we needed the advocacy to be backed up by evidence-based research. So I'm happy to see that the more time passes, the more research is being done into this, equipping governments, equipping activists, civil society organizations to be able to advocate for menstrual justice in ways that matter and make an impact and improve the public health outcomes for people who menstruate.
Pontsho Pilane, thank you so much for your time. That was the co-author of Flow, the book about menstrual health, really just looking and just speaking to us about, the issue of COVID-19 pandemic and the vaccine and the slight impact that it has on one's menstrual cycle.